Dr. Spero, thank you so much for doing this Q&A on rapid testing, which is becoming increasingly popular for us and our clients. I have a couple questions on rapid testing that we get often. The first one is, how can rapid testing utilizing the Abbott ID Now PCR units help higher education institutions open this fall?
To answer that question, I'm just going to say in general for health security for universities that are reopening with on-site live classes, testing is very attractive because it can pick up those 30 to +% of cases of COVID that are asymptomatic. And you can isolate those people, keep them from infecting the rest of the population, and reduce the chance of an outbreak at your university when you reopen with on-site classes. Rapid testing offers an additional value, and just to kind of share with you, quite often what people are using is send-out tests. So you do a nasal swab or saliva collection, then you send it out to lab. Well, those labs now are really backed up, looking at delays and results of 7 days or longer. And if you do that, then those asymptomatics that are infected could potentially be in your student population, infecting other people and creating an outbreak because you're waiting at least a week to get those results. With rapid testing, you have the benefit that you get results in 10 to 12 minutes. With positives, you actually get results in 5 minutes, which is great. And you can isolate those people immediately. So you know who the COVID asymptomatic cases are, and you can isolate them immediately. You can also use it for symptomatic testing as well, because you may have a student with flu-like symptoms, and you can know immediately whether they have COVID or not. So those are the benefits. What I say with a little caveat or qualifier is that rapid testing is a little less sensitive than send-out testing to a national lab or a local lab. So the sensitivity is a little bit less, so there's a slight increase in the number of cases that are positive that you'll miss.
Now, do you see a point-of-care test like the Abbott ID Now, the PCR test, as the way of the future because we can get results really quickly?
Absolutely. I mean, I just was talking to one of my ER buddies who's a professor at emergency medicine at the University of Pittsburgh, and they're really excited in their ER to get these. Well, they're getting a different test than the Abbott ID Now, but they're also getting a rapid test just for their emergency room. It'll help the workflow quite a bit in the medical setting.
Now, say we have a university client watching this now, and they're deciding on whether they're going to do in-person, a hybrid, or just go completely online. But just say they're considering the hybrid or the completely in-person, and they have a lot of students to test, and we know that the units can only perform around 4 tests per hour. How are we able to come on site and meet the demand that they may have, like if they have 300 to 400 students needing to be tested per day?
Yeah, well, you have to have a lot of units, and we do. We have 100+ Abbott ID Now units, which is kind of the gold standard right now for rapid PCR testing. We have a university today, as we speak, with 35 rapid ID Now units there, and 20+ staff, and we're testing about up to, I think we can do up to 1,250 to 1,500 a day.
So Dr. Spero, what are the advantages of rapid testing over send-out testing, like saliva testing or just a traditional nasal swab?
Yeah, so the advantages are the quick turnaround time. You get results in 10 to 12 minutes, and then you can act on those results. So you can quarantine people that are positive, and as we know, there's a significant percentage of COVID cases, 30+% that have no symptoms or asymptomatic. So if you can get those results immediately, then you can take action and prevent people that have COVID but have no symptoms from infecting the rest of your population. That's even more important now because the labs out there are having significant delays, and you're seeing 7+ day delays. So now you could have 7 a week or longer where you have people walking around on your campus that are that have COVID and we don't know about it. The rapid testing gets rid of that issue because we get the results within 10 minutes. It's a trade-off though, because you have a slightly decreased sensitivity for the rapid test. You have 90% to 94.5% for the rapid ID Now PCR test, and the send-out test is usually about 95% or greater than 95% sensitivity. So it's a trade-off, but it's a huge advantage if you can catch people early and keep them from infecting other people. So that's a significant advantage for the Abbott machine.
Yeah, that sounds like it. Dr. Spero, thank you so much for your time. I really appreciate it. It's been enlightening as always.
Thanks, Thomas. It was my pleasure. Take care.